Good morning, or good afternoon, or good evening, wherever you are in that equation. My name is Dr. Erica Steele, and we are going to talk about the 5 patient types that I feel really do the best with holistic medicine. And this is taken over many years of being in holistic practice. And so really kind of the patient populations that I've had the most transformations with, this is kind of isolated down of who I work with. As a holistic doctor, I believe in treating the entire person. So I work with patients physically, I work with patients environmentally, meaning like their work-life balance, their relationships, etc. I work with patients mentally, emotionally, spiritually, as well as ancestrally. So I really look at all aspects of the human being. And so, again, this really is going to speak to those 5 different patient types that really benefit strongly from holistic medicine. But first, I'm going to introduce who I am. My name is Dr. Erica Steele. I have accomplished many things in my career and are still doing that. So here's all my educational accomplishments. I have an AS in psychology. I have a BS in natural healthcare sciences. I have a BS in alternative medicine. I have a master's in public health with a concentration in complementary and alternative medicine. I have 1 doctorate degree in natural medicine. I have 1 doctorate degree in naturopathy. I'm a current MBA student in global business and marketing, and I'm a current PhD student in international psychology with a concentration in organizational systems. Certifications I hold, so I'm a board certified naturopathic doctor. I'm certified in clinical hypnotherapy, certified in neurolinguistic programming, certified in handwriting analysis, certified in functional medicine, certified in integrative medicine, certified in methyl genetics, certified in family constellation therapy, certified as a Hatha integrative yoga teacher, and a certified Kundalini yoga teacher as well. Practically, my journey in holistic medicine. So I am the proud product of 2 Marines. Both my parents were Marines, my mother and my father. And when I was growing up, they were both vegetarian, very interested in their health. So I was raised a vegetarian. I then later became a vegan and a raw foodist. Currently, I'm a pescatarian. I live in the Caribbean, so we have a lot of fish and things like that. I was raised really with a very deep connection to nature. We hiked, we rock climbed, we bouldered. We were really all about nature. I was also raised valuing physical fitness, so we worked out in the gym, mental health. I went to a psychologist starting really early on, and then also spiritual health is very much a part of my upbringing. I was raised a practicing Native American. We did ceremonies, vision quests, prayer ties, all kinds of different traditional Native American practices. Both of my parents actually have Native American backgrounds, so that's the tie that connects them. Unfortunately, my childhood was not the most glamorous, I would say. I was diagnosed with PTSD at 14 years old. At the time, they didn't talk about complex trauma, but it was complex trauma. That propelled me really into the holistic space. I left my home at 16 years old and enrolled myself in a massage program, and was the youngest person to graduate in that program. And I worked in the field for a long time. I worked with chiropractors, I worked in holistic healing centers, I worked in med spas, really all over the country. So I had a lot of really good exposure and really good experience. I then transitioned into teaching. So I was anatomy, physiology, kinesiology professor at several different schools across the country for years. And I really enjoyed teaching people about, anatomy, physiology, really how the body worked. I really, just really trying to heal myself. I started finding meditation practices and yoga and self-healing. And so I really delved more into my own self-healing practices and eventually healed myself from complex trauma. From there, I did a lot of high-level leadership training, conscious communication training. And then personally, I've been a mother. I am a mother. I've been a wife. I am a wife. And divorced. I've also been a widow. So I have a lot of actual life experience. It's not just the professional side, which I think is important to share. I've been in natural healthcare for over 20 years at this point, and I've been in business for over 20 years. I started my first company at 17 years old, and I knew two things. I wanted to be a doctor and I wanted to be self-employed. And to date, I've treated over 40,000 patients in general family practice and in natural healthcare. So I have a lot of practical experience in the field. So enough about me, though. Let's jump into who I really help and why I choose to work with these patient populations. So the first thing is I work with a lot of families that are transitioning from a conventional practice. My original purpose, if you will, of building holistic family practice was really to create a practice that I would take my daughter to. I raised my daughter completely natural. I taught her about nutrition. I taught her about homeopathy. I taught her about natural remedies. I treated her with all of those things. I taught her, about emotions and mental health, and I exposed her to a lot of holistic practices early on. So I firsthand have experience raising a child holistically. And so I teach parents coming to me that have concerns about conventional practices. They perhaps value more, natural healthcare solutions. They don't want to necessarily go that conventional model, respect medical and healthcare autonomy and choice and medical freedom. And so patients come to me because they don't feel like they're getting their voice heard or they're getting their needs met in a conventional practice. It's important to know that I don't replace the conventional practice because we fundamentally do two different things. A conventional practice is going to diagnose and manage disease process, and I'm going to build health. So I'm teaching families really about prevention early on. And how I really work with families is I teach them how to create a holistic lifestyle. I teach them, when your child gets sick, this is what you do, step 1, 2, and 3. And I teach the kiddos, okay, what does it mean to be healthy? And, they answer, drink water and, eat vegetables and all the things. And I teach them to be more empowered with all aspects of their self. I teach parents about boundaries and setting those boundaries so that children developmentally grow up understanding that there's cause and effect and that they have responsibility and cause, and really helping that neural development. I also work with a lot of families, unfortunately, that are coming from the school system that have attention challenges, behavioral challenges. And again, the school is now pressuring them into a conventional practice, and they don't want to go from the school setting to a conventional practice and model and get into all of the different components that may exist with that. Instead, they want an intermediary. They want to see if they can kind of get a handle on things and to see if their child is even a candidate for conventional practice, or if there's some things that we can do at home structurally. I've also worked with a lot of families transitioning. So meaning that, families that are, wanting to get pregnant, or families that are pregnant and prenatal, families that want a natural birth, families that want to raise their children completely natural, families that are divorcing and want to make sure, that their children are all on the same page. So I've also worked with a lot of family transitions. I work with obviously mom, dad, the kids. So also the nuances of being married and the nuances of, maybe when one family member has one lifestyle and another family member is choosing another lifestyle. So really bringing that cohesiveness, and naturally when you're getting into families, you're getting into family systems. Because I work with families, I've worked with all life cycles. So literally in the womb, all the way into aging care and have to work with even, families where the, elderly patient doesn't necessarily want to, or family member doesn't want to, let's say, leave their home, or, they need to go into more of a transitionary care or assisted living or even end of life care. I've done a lot of work in that realm and that component as well. So really, when we're dealing with all developmental ages, we're dealing with all aspects of what makes a family and a family unit. One of my big visions was really to, bring back those more traditional family values, but with a very modern approach, right? So, meaning that, building and help supporting families in whatever expression that the family is in really remain the healthiest that they possibly can. Being a product of a divorce, and knowing how disjoining and, sometimes very stressful that can be on children. Personally, I wanted to make sure that I created more of a family practice that really honored all aspects and really gave a voice to all the people in the family. So I tend to work with the family members individually, and then I can work with them on a group setting. So it's a very dynamic aspect of what I do, and very different, might I say, from conventional practices and also a lot of natural practices out there too. The next patient population that seeks me out and that I have great success with are patients with chronic disease. Now, I'm going to define what chronic disease is. So, a chronic disease is something that is inconsistent over an extended period of time, whether that disease process has been going on for 6 months upwards into years and years and years. And so, oftentimes, what happens in the chronic disease world is that they are being kind of sent to specialist after specialist after specialist, given all of these diagnoses. Of course, the diagnoses have lots of medication attached to it. So oftentimes a patient will come in with chronic disease and they have tons of doctors and they have tons of meds and not a lot of answers. And so this is where we really, I like to say patients will dump their lives on my desk and I organize it for them step by step and create a proactive plan. So some of the chronic diseases that I've worked with, and we'll go by systems. So in the digestive system, I've worked with IBS, IBD, colitis, Crohn's disease, chronic diarrhea, constipation issues. Those are, some of the main ones. In the hormonal space, hypo and hyperthyroidism, Hashimoto's thyroiditis, fibroids, nomas, I think that covers it, menopause, perimenopause, dysmenorrhea, which is, menstrual cycles that are not regulated, terrible, menstrual challenges as well. And anything in the kind of ovarian space, anything with the female reproductive organs and with the male reproductive organs, any challenges with those as well, which leads me into autoimmunity. So lupus, Lyme disease, all types of cancers. I mean, you name it, from lung to brain to digestive to prostate to breast to ovarian, uterine. I mean, you name the type of cancer, and I've seen it. Any kind of autoimmune condition, which a lot of times those are not necessarily labeled. Fibromyalgia, which in my opinion is more of a trash can diagnosis. So those are some of the systems that I've treated there. Neurological. So we'll talk a little bit about this when we get into mental health, but I'll summarize them here. So I've worked with schizoaffective disorders, depression, anxiety, neurodivergence, Parkinson's, ADD, ADHD, Alzheimer's, dementia, those types of cases. Brain fog, which is, not a chronic disease, but it's a chronic symptom. And then we'll talk about more metabolic disorders when we get into the metabolic disorders, but your hypertension, your diabetes, your hyperlipidemia, which is high cholesterol, your type 1, type 2, as well, diabetes, obesity, those sorts of things. I think that covers it, lose weight, gain weight, those kind of things, but we'll talk about that when we get into metabolism. And those are obviously not an exhaustive list. That's just right off the top of my head. Pretty much if you're a human being and you've developed some sort of, disease process, I've seen it. somewhere, in my career. Understand that we do not diagnose and manage. So different from a conventional model. Conventional models, what they do is they will look at the patient, they'll take the whole bunch of symptoms, maybe they'll do labs, maybe they won't, and then they'll label that person as having a certain diagnosis or disease process. The danger in labeling something is that it may or may not be true. And so in holistic medicine, we don't look at the body from the lens of a diagnosis, right? So here's what I mean. Here's an example. So let's say a patient presents and I'll give an example now. I have a patient that presented and they were diagnosed with Crohn's disease, 16 years old. Okay. So obviously chronic diarrhea trips, and they wanted to do, they'd already done like the endoscopy, colonoscopy. Now they wanted to do a scope. There's a lot. Now they really wanted to get into very aggressive treatment, right? It was diagnosed as Crohn's disease. And so, once they got into aggressive, measures, mom was like, pause, time out. Let's look at some other options. And she saw me on Facebook, and so reached out to me, and I consulted with her. Now, we've only been treating together for about 6 months, but in this particular case, what it was is you have a 16-year-old, boy who is very active, but is eating absolute junk, who had some mold exposure from a previous home, I believe, that they lived in, if my memory serves. And so his liver was overly toxic, and it was dumping into his digestive system and creating a big mess, right? So as we're working with this patient, we stabilize the diet, we stabilize the mindset around the diet, we supplement so that he's actually digesting and assimilating, we speed up the metabolism, we clean his liver out, we are now going to be working deeper into the digestive system. Now, at this point, he doesn't run to the bathroom, he has normal bowel movements, his energy levels have improved, and he is taking personal responsibility for his health. And now he is making decisions around his food. Mom isn't coming around and going, you can't eat this, you can't eat that, don't eat this, don't eat that. Because he feels so much better, that information has created something where he feels good. And so he's going to continue to do that because that's a big motivator, obviously, to feel good. So if I was a conventional provider, I would have diagnosed that as Crohn's disease and then, started the standard of care that is determined based off of Crohn's disease. I'm not going to look outside the box. I'm not going to look deeper. I'm not going to ask these questions to really understand the links between what the lifestyle behaviors are that are contributing to this chronic disease. So that's just one example of the type of work that I do with chronic disease patients. Another example of somebody with chronic disease, this is a metabolic condition, but so I had a lady come to me much older, and she was on 3 different hypertension medications. So she was diagnosed with high blood pressure, and she was placed on 3 different blood pressure medications, and her blood pressure was still not controlled. Okay. So the purpose of a blood pressure medication obviously is to lower your blood pressure. And so her blood pressure, even after 3 medications, was not lowered, and they were now talking about a 4th. And she was like, no. So she sought me out, and I worked with her. Of course, her mindset, her diet, she was like old school, Southern woman, ate all the things, that Southern women do, loved food, and loved food, obviously, for some of the wrong reasons, for emotional comfort, for support, soothing. So we worked on her mindset. We worked on emotional coping skills. We got her diet organized. We lowered her sodium in her diet. We lowered her fat in her diet. She started to lose weight because she was a large woman when she came to me. And so lost weight, even in the process, worked with her marriage a little bit. She was, a little stressed with her husband consistently. And so we even worked with him and worked with, her mindset around that. And at the end of it, she was off of all of the medications. So that's another piece that I work with is if patients come in and they are on medication and the goal is to get them off of medication safely, I can work with their primary or their specialist to be able to do that in a safe, effective manner where they titrate, which is just medication reduction, where we do that in a healthy, controlled environment where we're all working together, conventional as well as natural. Also, too, one last case I'll go over with this is I had a patient come in and present, and this patient stopped care, and you'll understand why as we go into it. So this patient was seeing multiple specialists. They were kind of a working autoimmune diagnosis. This patient was a military veteran as well, but had been bounced around the system. And this patient was on, I think, 13 different medications. Many of them were, psychotropic pain combinations. So as I started to pull all of the medical records as a hub, so I serve as a hub a lot of times, meaning that all of these different providers, I'm going to pull all their medical records and I'm going to pull them under one roof, and I'm going to look at them all, and then I'm going to see the checks and balances that need to be put in place. What I mean by that is you have one prescriber over here, you've got another prescriber over here, you've got another prescriber over here. The left hand doesn't always know what the right hand is doing, and they don't talk to each other. And so as I began to do an audit on this particular case, realizing there was a lot more mental and emotional things going on, a lot more trauma that was happening that needed to be addressed. And so part of the treatment plan was getting all of the doctors kind of coordinated together and us really kind of having a meeting of the minds and reducing this medication in a safe way so that she was down to just what she needed and not all of these other medications. So as soon as we started that process, the patient was like, I'm out of here, right? And sometimes that does happen where patients aren't ready to get well and aren't ready to face themselves. But that is a part of the chronic disease management. If a patient is ready and willing, we do get all of the specialists where, I am talking to everybody and I know what's going on. And again, left hand knows what the right hand is doing. And I do this a lot in oncology, especially because those cases are so we have to stay on top of those cases so much. And so we communicate back and forth. A lot of times the patients that are chronic disease, they're so frustrated. So they take to, health forums and Facebook groups and wellness blogs and all kinds of places. And the challenge is that there's so much to do in a chronic disease case, getting organized and knowing what to do first, what to do second, what to do third is incredibly overwhelming when you're already not feeling good. So I tend to work with this patient population, make it super simple, boilerplate it down, 1 to 3 steps at a time, and over time they progress and get better. So we touched a little bit on this already. However, work with a lot of patients with mental health. So what mental health issues? Anxiety, depression, complex trauma, PTSD, developmental trauma, ADD, ADHD, autism spectrum, all levels of functioning. Over the years, I've worked with, I can't even tell you how many people on mental health, even just people that don't necessarily come in for mental health, but they have a loss of boundaries or they're not even conscious of, the mental health implications of their life. I'll give you an example with a case that I had that came in with a thyroid condition. It's a hypothyroid condition. Actually, there's a video we did an interview together of her care. And so, she came in with a thyroid condition. Her intention was naturally to heal her thyroid, titrate off medication, and lose weight. Those were her goals, right? But as we started peeling back those layers of that particular human being, we realized that she was in a very toxic marriage with an alcoholic, and she was always kind of cleaning up his messes, tiptoeing around him. She had children, so she's trying to shield the children, all while disease and his addiction. And so she's carrying the financial weight of the house. She's in survival mode, right? And so she lost her voice. So of course her thyroid is going to be inhibited, and she's just eating on the go because her self-care, is not there. And so this is a case again where, she didn't come in for mental health. On her environment, which is an aspect of health, we started looking at, okay, what are your relationships like? What's your work-life balance like, right? And so as we started to really bring a flashlight to all of these instances, and it was very challenging on her part naturally, because there's all kinds of fear and emotion and grief and all sorts of things that come up in the process, and that's pretty. And this is also why I see my patients initially every 3 weeks, because I'm working to support them, encourage them, motivate them, inspire them, and hold them accountable so that she filed for divorce. She got the physical therapist or nurse practitioners. I also work with a lot of people in the media, because I've been in media for a long time, people in marketing. So I've worked with a gamut of professionals who have to operate at a very high level because of demands and pressures, etc. The one thing that's really unique about this patient population is that, and I would really fit into this patient population, we're always trying to balance our personal and our professional, and then also our personal, so excuse me, our self. So we'll do self, personal life, and professional life. Like it's this triad, right? We're trying to maintain our mental, physical, emotional well-being while also appeasing to our family, looking at the sources of our stress, because hypertension, one of the causes can be stress, and perfectionism and all of that. And as the executive producer and president for Harpro and Oprah Winfrey Show, and the reason that I'm bringing this up is because she's very vocal about it, and I work with her like I work with any of my other patients, right? And so working with her on this transition of being at the top of her game, working in such a high pressured environment, to now, kind of transitioning into more of a retirement. I wouldn't say she's completely retired, but, moving more into a phase where, she can now choose herself and choose what she wants and choose what works best for her, right? And what does that look like? And then also holding her accountable, right? So it's like, you really look and have that level of accountability, because oftentimes as high level professionals, we don't have that level of accountability. And then, wanting to move overseas, wanting to leave the States and the contentious nature of the States, and finding a way to do that with my love, and then rebranding and rebuilding my practice in the online space to be able to help more people and build a community that I love. And so I take my own medicine. I'm not a person that it's not like say as I do as I say sort of thing. And that was one of the reasons why I did not go deeper into the psychology realm, like becoming in LCSW or an area that they love, but then 3 other areas may be crap. So making sure that everything is operating, well. So I love working with my high level professionals, because we get a little bit of business, a little bit of mental, a little bit of emotional, a little bit of physical. We get it all. All right. And you know what? I left off my metabolic peoples. Okay, so so sorry for that. Before we conclude, let's talk a little bit about the metabolic health patients. And so I don't have a slide for that. Amazing results and success. In fact, there's a mental health professional that I work with now who she's down to the weight that she was, in college. Like she's like, holy cow, and had worked with other holistic doctors before, had tried all the things, and nothing worked. And so to be able to, have this amazing experience where, she's actually able to see the scale go down and able to see the inches lost, has just been phenomenal for her. And so I'm really excited to be able to do that. And so I work with people as fast or slow in that process as they need. So I have another case too, where she's working with forwards and then one step back. And so it's been great because it's at her pace. There's no shame, there's no judgment, there's no ridicule. It's all love, all support, and we get to the root causes of why, because there obviously there's mental, emotional, and traumatic factors that prevent people. And when they identify, as a big person, we have to literally change their identity from the ground up. And so That's kind of what we're doing now. Also working with patients that are losing weight and losing weight sometimes rapidly or unexplained. This can be a lot of times because of a chronic disease or an infection, or let's say if their appetite is just dead. That can also be a sign that there is an infection that hasn't been caught, and or they're just not, they have programmed their metabolism to just not ask for anything. So and metabolism isn't always relative to weight, it's all the chemical processes. So if they've stopped eating, or they only eat once a day, or things like that, they've killed their metabolism, and so there's not enough energy going in to going out. So now they're in such a deficit, and so they're losing weight, sometimes in a very rapid way. When it's coupled with chronic disease, let's say like cancer or something like that, we also make sure that we keep the crossover. So making sure that we optimize their nutrition, optimize their mindset, optimize. Climbed Mount Kilimanjaro, she was the only one that did not get sick, because we built her immune system. Have metabolic conditions, the pain points, they've tried everything. They have tried it all. They have tried, again, all the diets, all the things. Maybe they've had success, maybe they haven't. They're stressed, they need focus, and they have a lot of interest in nutrition and meal plan and fitness things, and maybe they live in the gym, maybe they're a fitness bro or whatever. I've also worked with people who are training for fitness competitions and things like that. So even though that's not my specialty, I have worked with it just to keep the metabolic system kind of in check. So sorry about the slide again, but all right. So the last part we'll talk about before we wrap up is, these are the diverse patient populations that I've worked with, at least the ones that I find that I have the most benefit to reach and help, and who I enjoy helping, right? And so when we're dealing with when we're in the holistic health realm, again, we're dealing with all aspects of the human being. It's not just one thing. As we're peeling back the layers really of symptoms, we're able to start seeing some of the root causes, and the root causes become so profound that now we're able to address them. If we don't address the root cause, of the person, then, it's not going to help. So I'll leave kind of with one last patient story. So this one's a little sad, so bear with me. But I had a patient present at, they were like 50, early 50s, 5 children, married, and liver cancer. And had been through conventional treatment. Realized that he had had a mold exposure. Then the mold wasn't treated properly in his body. It manifested in his liver, created the disease process. His liver couldn't clear it out. Then he was exposed to herbicides and pesticides during spraying and stuff like that, which exacerbated the mold issue. Then when he went into the ER and they found that, then they obviously gave him chemo. I think they just did chemo. They did the chemo that blew the entire mold situation up even more. And so by the time he got to me, he had been on so many rounds of the chemo, different types of chemo, that now the mold was absolutely out of control in his body. Like we just couldn't get a handle on it. So it turned from a chronic disease acute case into an end of life case. Unfortunately, I had to assist him and his family in that process of protecting his rights, as well as his how he wanted to go into his passing. And so working with the families and working with all of that with the care teams in the hospital, and all hands on deck. It is also for people to stay engaged and people to really take personal responsibility for their health. Doctor in Latin means teacher. That is my job, and my role is really just to teach the patients how to heal and how to get well. It's really up to the patient to take the steps. And I've had great success with cases, and then I've had other not so great successes because the patient's like coming to me arms crossed, like, I dare you to help me kind of thing. And I understand their plight too, because they've been let down by so many other healthcare providers. I do address and deal with a lot of medical trauma in my practice, where people have been dismissed, not heard, put down. I can go into all kinds of different, patient where, one patient specifically, woman of color, older, 4 children. She had a stroke and it was dismissed multiple times, and she was told it was stress and sent to psych. And come to find out it was a stroke and she lost function in her hand. And, so, dealing with that, like, how do you re-enter the healthcare, community, if you will, or the healthcare system when you've been dismissed or you've been traumatized or you've been let down. So I do deal with some iatrogenics on that, which is medical trauma. All right. So if you want additional information, I'm going to put links in the description below. So if you want to book a complimentary group visit, I do a 15-minute complimentary group visit where we pretty much just talk about the basics of holistic healthcare, how it works, how much it costs, that kind of thing. So you kind of get that feel. It's not a personal visit. I think you can book like personal questions if you want, but it's more of a general presentation about holistic healthcare. If you want to take it a step further and you're like, yep, this makes sense to me, I see myself in one of these patient groups, then you can go ahead and book a 1-hour consultation. The 1-hour consultation is the first 2 office visits, and it includes your lab review and treatment plan. I do create a 30+ page report, and I go over that report with you in detail, where you are currently with your health, and then a proposed treatment plan. There is a $200 fee for that package. There's no obligation to move forward past the consult, and you get a nice pretty report as well as understanding your health a little bit better. If you're not ready to invest and you're still like, yeah, I'm just kind of still trying to figure out this, holistic health, world, I do have an ebook guide to holistic makeover. I'll include in the link below. And then we also email out weekly newsletters on various topics. So like this month is all about time management and really having ownership of your time as it relates to your nervous system. And so you'll receive lots of content with that. And I drop lots of content on YouTube and TikTok. And so you'll also get all of that information. I have a monthly focused webinar. Again, like I said, this month is all about time management, optimizing your time and owning your time and loving your time and finding peace with your time. And so the monthly webinar is all about time, at least this month. And then every month I'll do a public health webinar that relates to a specific topic. If you're craving community and you want free resources and education and stuff, please join our Discord, where I post lots of free resources in there. We're trying to build that group, that community up, because it just started last year. So awesome. Well, thank you guys so much for watching, and hopefully you learned a lot, and super excited to see you around the interwebs.